Every week, 12 babies are born with a heart condition in New Zealand. Nigel Wilson, a paediatric consultant, specialises in rheumatic heart disease.
The majority of children's heart units in the Western world are dealing with congenital heart problems. But in New Zealand, because we've got rheumatic fever, we have a number of operations per year that are to deal with rheumatic heart disease.
There are high rates of rheumatic heart disease in Māori and Pacific Island communities. Those specifically at risk are school-aged children. Tanya Makasini had 5 healthy children until her daughter Suliana contracted acute rheumatic fever, which developed from a sore throat.
Suliana born healthy child, never been in a hospital. We only stay in a 3-bedroom home, but we got 5 kids and it's cold house. She had a sore throat and I take her to the GP and just send us home with a Pemo. And I give the Pemo to her and the pain's gone. And after about 4 months, it's come back again. The doctor looked at her and she said, you take your daughter to Middlemore because her heart is beat very fast for her age.
I felt really scared when I went inside the hospital. There are heaps of nurses taking patients everywhere. Then I was scared that I might be like that too.
They take us on that night to Starship. As soon as we get there, Dr. Tom from Starship, they have to take her to the town with the feeder because Suliana's got a pneumonia and on her chest, and she got a fever and it's got the fluid in her heart. And I thought that Suliana not make it to the next day.
I couldn't move and every time I moved, it felt really sore.
So they told me they're gonna remove the fluids from her heart. And she keeps saying to me, Mum, I don't feel I can make it.
Acute rheumatic fever follows from a sore throat when there's been a germ called the streptococcus, and we shorten that called the strep throat. And then 10 days, 2-3 weeks later, the body seems to react and get swollen joints. But unfortunately, the heart is the one problem. When they get inflammation of the heart valves, that can lead to permanent heart damage. If you're in the high-risk group for rheumatic fever in New Zealand, then you should have throat swab, and then if it comes back positive for strep throat, then you would start with 10 days of oral penicillin.
Although Tanya took Suliana to the doctor on numerous occasions, her sore throat was not swabbed to check for the streptococcus bug that causes rheumatic fever. In order to prevent any further damage, Suliana must get penicillin injections every 28 days until the age of 21.
If you have recurrent rheumatic fever, then each time the heart gets worse. You get more and more scarring in the valves, and the heart gets bigger, the valves don't work so well, and those are the children who might need heart surgery, or they may just go along and need heart surgery as an adult. So it's that recurrent rheumatic fever which is so dangerous.
And when I look back, they give Pemo all the time. And I was thinking, if the first time I take my child to the GP and they give her treatment that time, I don't think that Suliana came with the heart problem.